my first meeting. I got in, and as you've noticed, I talk a lot. I don't know how to shut up. I did,
it's important. You have to, when you sit in a board of 43 and you're only 3 women,
yes,
you need to be able to vocalize and speak up. Otherwise, you don't get heard.
In a program that I've done in women leadership called Women Lift Health, they say you have to occupy the space.
You do.
In the year 2017, the doctors had a 100-day strike. And some of the people we got the government to listen to was the declarations by the World Medical Association. And that really helped sort out some of the issues of that. So we are.
You being President-elect,
yes,
President of World Medical Association.
Yes.
What is your manifesto?
An estimated 1.1 million Kenyans fall into poverty each year. And that's because of healthcare costs. Would SHA, SHIF, UHC change that? Or is there more? Or perhaps, what's the difference between a pharmacy with a Blue Cross and a Green Cross? What about cancer and the rising incidence amongst the youth? Is it just lifestyle changes, or is there more?
Women's health, men's health, your children's health, the economy, this and more awaits you on season 2 of Kenya's favorite health podcast.
My name is Dr. Diana Wangari, and welcome to season 2 of the One Health Lens podcast.
Hello, welcome to the One Health Lens podcast, where we have conversations around health and related topics, making them simple and easy for you to understand. I'm your host, Dr. Diana Wangari.
And I am Dr. Simon Kigondu.
Hey, you've come with energy today, huh?
Hey, we have the president here of the world.
We have the president. I mean, today we're having an important honorable guests. We have in studio with us the president of the World Medical Association, who's a Kenyan, by the way. The conversation today is around, what does that mean? Does that mean Kenya is about to change? Do we have job opening on the global stage? I mean, and more. I'll let the guest introduce herself and we'll get going. Right. Doc?
Thank you very much, Diana. I am Dr. Jacquline Kitulu, and I am the president-elect. So there is a current president.
Yes.
So I'm the president-elect, and I will be president from 2025 of the World Medical Association. But other than that, I am a practicing general practitioner. The Americans would call me family physician. Yeah. I am a mother, I'm a wife, I am many things.
Many things,
yes.
Women tend to be.
But really passionate about changing the health space, advocating for, patients' rights, a better global health platform in one in which we can all learn from each other.
Absolutely.
Yeah.
I mean, Karibu, it's good to have you. Yeah. I mean, all people... most people tend to ask, why go into medicine? Why did you go into medicine? What led you down this path?
So that's I've been asked this so many times, and when I think back to when I really first thought I wanted to do medicine, I was 7 years old.
Is it?
Yes, because I got unwell and I was admitted at Gertrude's Hospital. Yeah. And they got me well, now I know I took a drug that I was allergic to, and I got extrapyramidal side effects. And all my mother saw was this child take medication and then start making funny movements and funny eye and tongue movements. Yeah. And I was in hospital for a couple of days. And I thought, this is something interesting that I would like to do. Yes. Of course, it helps that my uncles, 2 of them were also doctors. So how you look up to certain people and say, this is what I want to do.
Yes.
So really, from as far back then, that's what I wanted to do. 7 years old. It helped that in high school, I was good in the sciences. Yes. So of course, then you're projected that way. But I was really clear. I was, even when we're choosing, your choices for university.
Yes.
I was like, medicine. And they're like, no, you have to put in something else. I said, there is nothing else I want to do.
This is the way.
Yeah. And now, even after practicing 25 years, I assure you, this is exactly what I would pick again, without a shadow of a doubt.
You're one of a few. There are few people.
Few. As we were just clever, we chose medicine.
I tell you, we happened.
We happened is the word.
My son asked me the other day, he's 24 years old.
Yeah.
He says, Mom, now that you're World Medical Association president, like, why do you have to work? I said, I work in medicine. I see patients because I love what I do. So he said, let me give you a scenario. If we gave you a job where you'd earn, triple even what you're earning now, and it gave you more free time. But there's one proviso, you can't practice. Would you take that job? And I thought, I said, I would have a problem.
Is it?
I would have a problem.
More money, more time, and you still have a problem.
I would have a problem because I want to still practice. So now I'm practicing like 50-50.
Okay.
50% practice and 50 is the policy work, sitting on health boards, places where I can influence change in the health sector. So I am passionate about seeing my patients.
Okay, we believe you. We believe you. When money has been mentioned and you still turn it down.
Yeah, I've turned down the money and time.
And time especially. I tell you. I mean, then it hasn't been easy, I'm sure, right? Because between what started off as clinical practice, right? And you rising up, as they say, the ranks and getting to sit on quite a few tables, right?
Yeah.
I'm sure it hasn't been easy. You've seen the health industry evolve over time. 25 years, there's been a bit of evolution, right?
Yeah.
Maybe tell us, what have you seen? Because from clinical practice, at some point, medical association, you sit on multiple boards. Tell us, what are those boards? But what has been that evolution that leads you from one point to the next?
Another. So
start with the pediatric story when you sat on a puncher.
You sat on a puncher.
No, so I think what really, so you've already known how passionate I am about my patients, and if you ask them, they'll tell you how passionate I am. But really, even so, when I did internship, I think for me that was the biggest turning point for me.
Yes.
Because in internship, it is hectic. It is busy. And I was doing my internship at Kenyatta National Hospital.
Ooh, lucky few.
And, the wards then, which should have had like 40 babies, you'd have like 120 babies. You admit, on the night that you're admitting, you have so many who are still there who you have to get out, and others who are coming in, and you'll work almost like 72 hours straight. And there's this one particular child, and I've never forgotten. It's more than 25 years. The baby was called Kemunto, rest her soul in peace. And I had seen her in the ward initially, and she had come in as a baby with kwashiorkor. And we got her back on track, told her mom how she needed to be fed, and they were discharged. But towards the end of my session, because you do 12 weeks in each rotation, she came back. She was one of the babies we admitted in the night. And that baby had, they had given her some traditional medication of some sort. She had aspirated it. So we had to bag her. She couldn't breathe on her own. We needed to get her into ICU. There was no space. It was such a nightmare. We really bagged that baby for like 3-4 hours with the nurses. And remember, this is a busy night where you're admitting. So you're sort of rotating, your hands are stiffening, you get someone else to bag. And, at the end of the day, we lost that baby. There wasn't enough room in the ICU. There wasn't even the manpower, the health resources required for that. And that really broke my heart because seeing that child go amongst the many other babies that I'd seen there, and babies who were not enough of us, and you have to do a lumbar puncture where you take fluid from the spine, and since you have no one else to help you, you have 2 nurses in the ward. They are busy giving meds, doing a whole lot of other things. You tell the mother, fold that baby, hold that baby, and and you stick in a needle. When I got my own children, I thought, oh my goodness, that's heartless
trauma.
How do you do that to a mother and tell her hold your child and tell her mama now sitting is and I realized for me that this job that I really loved, I was losing any empathy, any passion, any because you sort of have to put it aside.
Yeah.
If you have to deal with 120 patients,
Absolutely.
you have to become mechanical. That this has to be done, this has to be done, and and
You're
move
clearing
on.
the queue.
You're clearing the queue. And I'm one of those people, I don't know how to do things in half measures. I have to do it all. So I would like remove the now emotions and then machine. I said no. So when I finished internship, I said, if I remain in this sector, I'm going to lose the passion that I had. So let me go into the private sector.
Yes.
And I went to private sector, but with a lot of guilt. I said, so if all of us decide to step away, so then who will remain?
Exactly.
The majority of the services are offered in the public sector. So if we all step away, then who remains to do the work? So that's what drew my interest now in beginning looking for places where I could be a change maker in the policy setting. So then I got into the Kenya Medical Women's Association and I chaired that from 2008 to 2012. And while in there, the Kenya Medical Association poached me. Well, in a sense. I think they saw something.
They saw.
The first thing actually, before they poached me, they nominated me to sit on the National Economic and Social Council, which was a think tank for in the President Kibaki's time. So they'll have private sector players come in, to diversity, bring in these ideas. Well, diversity on agendarless wasn't much. There were like 43 members and we were 3 females, and it's a National Economic and Social Council, but most of the discussion was
the 50% was not represented.
It was economic discussion, never the social, where the health was. And I kept on saying, you need a healthy nation to get to this level. And they even started to call me Madam Social Issues. And I said, it's okay, call me Madam Social Issues, but we need to get this information onto the table.
Yes.
And so I realized, even in that setting, that the reason, maybe from a health perspective, as health advocates, we don't get our policies changed because we don't speak the language of the policymakers.
Yes.
So we are speaking something different. We talk about the issues and everybody looks at us and their eyes glaze over, but they don't change anything.
Exactly.
So I realized
they empathize, but they do not see the return.
They don't see the return. I mean, they're just looking like this is just a drain. So that's partly why I did an MBA in healthcare management, to learn the language of the policymakers. But anyway, away from that, then I moved into KMA, and where I started as assistant secretary, and then I moved on to vice president, and then the first female president. So in all these places, now those opened more doors for more places to sit and influence change. Some of them, like the Kenya Healthcare Federation, which is the private sector, the health sector board of the private sector. Through that, I sat on the board of NHIF, I've sat on the Kenya Medical Practitioners and Dentists Council, and then several other private boards. And in all these places, my vision is just to be part of change making in getting our health sector to work better. And it's not just matters health professionals. The health workforce is critical. It's fundamental. I always say they are the cog that you cannot subtract from the building blocks of the health system.
Absolutely.
Because if you remove them, then it could be a school, it could be a hotel
Absolutely.
industry.
It's just a building.
It's just a building. But you need those in there. So even where I have sat on a digital health company board, it's so that I'm ensuring that the digital health aligns with giving quality care that's affordable, that's accessible. So in all these places, that's been my vision. How do we make that change that ensures that the person who receives care at whatever level receives the best care that they could receive? So that's how I assuage my guilt for running away.
Clearly, I mean, wealth of experience sounds like a 360 view. It's not just clinical practice. It's not just healthcare and doctors alone. It's digital, it's policy, it's research. There's all that. Then one day you get a call. And you're told the World Medical Association is calling you. And you're like, stop. I need to pick this call.
So the World Medical Association, it didn't happen exactly like that. But indeed, it could have. So the World Medical Association is a federation that brings together national medical associations. So right now it has like 115 members.
Okay.
And its mission and purpose is to ensure the highest standards of medical ethics, ethical standards, human rights, patient safety, physician wellness as well. Now, how does the WMA story come in? So at the time when I came in as president of KMA, the previous chair of KMA had got KMA back into the WA membership. So it's a membership. You get in as a member, and you have to pay for your members that you register as members, and that gives you then a voting right.
Okay.
We have very few doctors in Kenya. I think right now we're at about registered 18,000. But you get one vote for every 10,000 doctors. Can you imagine? So it's a tricky one, because there are people who register 200,000 or something. But anyway, so getting back, KMA getting back into WMA, we began to engage into the WMA activities. And there's several things that came from that. Yes, my first meeting I got in, as you've noticed, I talk a lot. I don't know how to shut up. I did,
it's important. You have to, when you sit in a board of 43 and you're only 3 women,
yes,
you need to be able to vocalize and speak up. Otherwise, you don't get heard.
In a program that I've done in women leadership called Women Lift Health, they say you have to occupy the space.
You do.
Yes.
You do.
Occupy space is the new hashtag.
Occupy the space. So indeed, when I got into WMA, I began to occupy the space.
You have to. But what is WMA in the first place?
So it's the World Medical Association. As I said, it's a federation that brings together national medical associations.
Yes.
And in terms right now, 115 members. So those are countries that are members, but also individuals can be associate members. But most important is where did WMA come from? And why did it come up?
Exactly.
So it was established in 1947. And the reason it was established, 1947, if you remember history, what had just happened? World War II had just ended. And in World War II, there were quite a lot of atrocities done. I know, and if you ever followed or read the history of the Nuremberg trials. So, medical practitioners, physicians were made to do things that by any ethical standard you shouldn't. So the members that gathered initially in 1947 gathered in France, and there were like 27 of them. And they came together, they said, no, we need to work out a strict code of ethics that will ensure that we'll never ever have physicians engage in issues that are so against you, any right of anybody. So that's where they came up with their mission about ethics. So it's very big on ethical standards, on human rights, on the patient's rights, on physician empowerment and wellness. Because you see, if that physician is not also taken care of, they're not able to deliver. And of course, they work through development of several declarations and policies. And the first declaration actually was in 1948, which is the Declaration of Geneva. And it's the modern day Hippocratic Oath. And it talks about, how we shall behave, the standard at which we have. And in there it incorporates me as a physician, it incorporates you as the patient, it incorporates the teachers of the physician, but all of them that we are doing, whatever we are doing, will be to protect the patient who we serve. And we don't protect the patient who we serve just even when they are alive, even when they have passed on. We shall protect their secrets, we shall ensure, we shall not discriminate, we shall never do anything that is against our patients.
The health and well-being of our patient is our primary duty.
Absolutely.
It is. I mean,
that's the line. That's a line.
It's the slogan.
The Hippocratic Oath. It's a line.
So it's a modern day one.
It is. But I was even going to come to Kigondu and ask you. There's the conversation around KMA left World Medical Association, then rejoined. Why was it important to rejoin? Because then we'll get to hear, then maybe these are the benefits that KMA has had from being part of the World Medical Association.
Yeah, so the World Medical Association is like a subscription federation. So basically, you have to pay per number of doctors you have. And therefore, some people who may not join may do it financially. Maybe they think that they don't want, but it's not too expensive. So the number of doctors you have, you pay per doctor, and there is an amount. So in 2014, as Dr. Kitulu has rightly said, our past chairman, Dr. Nyaim, through some conversations, had KMA rejoin the WMA. And it was not only KMA, there was Zambia Medical Association, I think, and Rwanda, I think, at that time. And we have that. Previously, we had our inspiration, Dr. Margaret Mungerera. Dr. Margaret Mungerera was the Uganda Medical Association chairman in the year 2000-2001, but she was the World Medical Association president in the year 2013, I think. And as a result of that, I think she saw, hey, in 2013 we are few, so let's get more people on board. So KMA joined. In 2018, we sent Dr. Kitulu to the World Medical Association General Assembly, where they announced, oh, who wants to host 2023 World Medical Association Council? And she raised her hand. She just raised. She didn't even know whether we would be able to, but we were given. And 5 years later, we actually hosted the WMA council session. It's a big thing, and we really showcased Kenya. And this really helped us when we were campaigning for the WMA presidency, because a lot of people knew us, but our regular activities are good. And one final one is that in the year 2017, the doctors had a 100-day strike. And some of the people we got the government to listen to was the declarations by the World Medical Association. And that really helped sort out some of the issues of that. So here we are. You being President-elect, President of World Medical Association.
Yes.
What is your manifesto?
What is my... I had a 3 points.
We had a 3 points in the campaign.
Three pronged.
3 points.
Yes, three pronged. Number one is interregional collaboration, because I realized that, yes, even just seeing from what we are doing as Kanma, there's a lot we are learning from each other as regions. And actually WMA has those sort of regional arrangements, the ones who are within Western Europe, the ones who are in Asia. So within the regions, people are collaborating, but there's no interregional collaboration. And yet we are facing the same challenges, like about digital health, about climate change.
And medical interns.
Medical interns.
Human resource for health issues.
It is an issue all over. And what lessons do we have to learn from each other? How can we share that? So there's the interregional collaboration. Number two was really about mentoring into leadership the younger generation, because those are the people who have to take this forward. And for me, it was a big one, because the way I see Gen Zs and millennials are very passionate about fairness, about justice.
Social justice.
So it is the right place for them to be. So we need to mentor the younger physicians into this leadership role, but along with the younger associations. So there you find that like Africa, even at this recent Helsinki meeting, were only 7 countries from Africa present. Of course, there are many reasons why that may happen, but we also need to mentor the younger associations to get the value that they need from there. But now when you ask the question, how will it help the Kenyan? So my third one was on the issue of ensuring that we put primary healthcare at the forefront. Because primary healthcare delivered by an empowered workforce. So you cannot disconnect that primary healthcare from an empowered, well looked after health workforce. Ensures then that there is service delivery. Ensures that health workforce also prioritizes where do we start first. So indeed, you look at people thinking about, CT scans, MRIs and everything. When you look at the big picture, most of the issues you deal with, 90% of the issues can be dealt with at a primary healthcare setting. But when you don't have a properly structured primary healthcare setting, then it means that people, the issues which would have been basic and dealt with complicate. Then they have to go into secondary, into tertiary, into abroad, looking for that care. So the idea then is to ensure that as the professionals, we engender these policies of primary health care and support. Yes, I know in the country right now, there's even the idea of a primary health care fund. Those are the sort of things that you're saying. Then what are the components? How is this service getting to the patient? It may not be that there'll be jobs brought, but a lot of the changes that are made to ensure that you get what is right for you as the health seeker comes from a policy level.
Absolutely. And it's not politicians dictating, which tends to be a big issue, right?
And actually, that's a big issue about World Medical Association. Professionals, we need to come out. Yes, we need to continue treating the patient. Because when you want to come here, you want me to treat you. But we must be at the table ensuring that the right things are being done. Because we sort of, sometimes we are so busy on one side, we leave it to the politicians to do, and they'll do what they know best. You know, you can't blame them, they have to do something. But so we must learn to sit in that space and be part of the change makers in that space.
Kigondu, you have faith in our president?
Which president?
World Medical Association.
That was a tongue-in-cheek, but in the first week of October 2025, we are planning to take a huge delegation to Porto, Portugal, during the inauguration of our president.
Am I invited? You know these things.
Everyone is invited now. We have started resource mobilization to be able. We have informed the real president of the country. We have informed the Ministry of Health and our members to join us in Porto, first week of October, so that during the inauguration of the WMA president, Kenyan flags
line up the
streets of Porto.
I tell you. Doc, call to action, final message, because I think where we are, not just as a country, as you said, it's what we see in Kenya is something that many other African countries are facing, right? It might not be the exact, policy issue, but the challenges from a patient, from a citizen perspective is we want accessible healthcare. Affordable healthcare, and this, if we're to able to solve for this, doesn't matter whether you're in Kenya, Zambia, whether it's through whatever fund versus, all those are details to a Kenyan or to a citizen or to a patient, right? So then, final question. When you think about the future and when you think around, it could be a message to policymakers, politicians. It could be a message to Kenyans who need to just hold their leaders to account. What would be your final message?
Wow,
it's a broad question.
That's a very broad question.
I know.
And the message to the patient, the message to the
policymaker, politician, they're very different.
They're very different.
But pick one, because.
But I think to the policymaker, and I think the reason I pick that is. Because a lot of what WMA does and what KMA should do is to influence how policy is made. And I think my message to the politician is that they need to have the professional sitting at that policy table in whatever form, because the person who actually does the work adds so much value to the policy that is made. There's sometimes, when you sit on a policy tables, it's very theoretical. If we do 1, 2, 3, it will result in this. But when you have the professional who actually does those details, that doesn't make sense. This perhaps makes it in a better way. But the same way, even as I say that the politicians should have the professionals should be willing to step up and sit on that policy table. They need to sit and up their game also in terms of learning the language of the policymaker. Because for us as professionals, as practitioners, I deal with you one-on-one. You're my 100%. For the policymaker, there's millions of you, and they want to see how do we help these millions, not just the one. And the best way to do that is that partnership. Have the policymakers, have the professionals on that same table, then you are working towards the same. The idea is that you're getting a better health for the people to deliver a better health for the people.
Yes.
So, yes, get those professionals onto the table. And I think there are many spaces provided for them, not always filled,
Yes.
but it should be critical. Just like now we look at the gender aspect. Do we have enough females on the board? Do we have enough of this? So anywhere that there is any health policy issue, you should have the professionals sitting there. And indeed, we appreciate that for KMA
Yes.
sat on NHIF, sits in the KMPDC, but in more and more places, bring in the professionals. They're not there to disrupt, they're there to add value. At the end of the day, as that Geneva Declaration says, the well-being of my patient should be the first priority. And that will be the outcome of such sittings.
Doc, I would say 7-year-old you would be very proud of you. Very proud. Very proud.
Yeah.
And we look forward to having you again. When you're president, we evaluate this manifesto, how far we've gone, things.
We shall look for you. You can be sure Dr. Kigondu will look for you. Especially now that you're one of us, being a medic. You're in this manifesto too.
We have to go walk the journey together. Yes. And thank you for joining the One Health Lens podcast. We'll see you next time.